Welcome to In a Heartbeat, coming to you today from the studios of WMTV here in Grosse Pointe Farms at the Grosse Pointe War Memorial. I'm Dr. David Balle, and welcome to In a Heartbeat. I'm very pleased to have two special guests today for our program. And one of them is Carmela Wilder, who's a clinical social worker, and the other is Cynthia Shields, who is a nurse practitioner. And together we're going to be sharing with you some really exciting information in a new venture here in the Grosse Pointe area at the Ralph Wilson Center, which is called Resources for Independent Living. And this was relatively new for me as well, as I was sharing with them earlier, and I'm excited to hear about it too. So maybe just to start out, maybe each of you, Carmela and Cindy, you could tell us a little bit about your area of specialty and your background and your training, and then we'll kind of get into, what is this Resources for Independent Living?
Okay, certainly. Well, good morning. My name is Carmela Wilder, and I am a clinical social worker with Ascension Health, St. John Health. I have been a social worker for over 20 years, studied here at Wayne State, and my area of interest has always been in healthcare when I started my venture into social work, and I've always been interested in working with seniors in the older population. And so I've been very fortunate through the years working with St. John Health System to be able to give service to seniors. A lot of my time was spent in the hospital setting, so working in a direct care setting. And when this venture was proposed, that St. John wanted to broaden into a broader scope of senior services, I was very excited, and I feel incredibly fortunate to be part of the team and to be able to work with Cindy, my nurse practitioner partner.
And Cindy, how about you?
I'm a geriatric nurse practitioner by training. I worked in cardiology as a registered nurse, and I went back to school. I've been a nurse practitioner since 2014. I worked with Carmela actually on the ACE unit at Macomb Hospital, St. John Macomb, which is an older adult unit. So we found a love of geriatrics on that unit together, and when this opportunity came up to bring the geriatric care into the community, we both wanted to be part of that. We were excited to be able to build the program together.
Excellent. So maybe the two of you together can give us maybe a start of an overview of what is this program?
So we're a comprehensive geriatric assessment service, and we specialize really in older adults that have functional decline, cognitive decline, people that are just struggling at home. We want to keep them out of institutions, out of nursing homes, out of the hospitals. So we do an in-depth assessment with multiple disciplines that looks at different factors that tend to lead to those institutionalizations. So we have myself, Carmela the social worker, we have a pharmacist, we have a cognitive screening that's pretty in-depth, and we have a fall and balance assessment with the physical therapist. So all those things taken together results in a comprehensive assessment, usually about 3 hours, where we look at everything from physical status to medical history to their ability to ambulate, be safe in their home, process information, what do they need help with.
And as we all know, the senior population is growing tremendously, and people are living longer, and I think people themselves want to live independently, and their families would like that as well. I think if that's an ideal situation, if that's possible. So take us through maybe how would somebody know that they're a candidate to visit you, and how would they make an appointment to do so? Or how would a family, that a loved one may have a need here, and take us through what that experience might be.
Okay. So our clients can come from any source. We're not a clinic per se where you do not need a prescription. You don't need an order from your doctor to come see us. So we've spent a lot of time working with the community groups, the SOC, the Family Center, the Area Agency on Aging, to let the different groups know we're out there. We've spent a lot of time talking to our local physicians. we see ourselves as an enhancement to those physicians. So hopefully they know we exist. And then they can call us and say, I have a patient, they're starting to have some problems at home. If a family member knows about us, a family member can call us and say, I'd like to bring my mom in. We've had clients that, in essence, self-refer. They have found us at perhaps a senior expo or something. They've gotten our literature, and the client themselves will call and say, gee, I'm really wondering, or I'm starting to worry about my memory, or I had an incident the other day, or I just want to see where I'm at. I want to get like a baseline. So our referrals can come from anywhere. And it's simply a phone call. It's a phone call to the Grosse Pointe office or to the Novi office, because just to add, we have an east side and a west side. So we do have the Novi Center at Providence Park and the Grosse Pointe Center here. But a simple phone call, make an appointment.
And do we know what that number is? And perhaps it's on the screen.
The easiest way to find that number is through the St. John website.
Okay.
Or our 800 docs number.
Okay.
The Novi number is 248-465-5330. And
Grosse Pointe is 313-264-6460.
Excellent. So anyway.
So we'll schedule the appointments. Most of our appointments, if you do the full complement, it is about a 3-hour event of coming and spending time with us. Now we have progressed as we've been moving through and clients are coming through. We also do offer a la carte services. So if someone comes in and says, I really just want to do the cognitive testing, or I just need to see the social worker, they can do that. So we can break it up just a little bit if someone doesn't feel they need all the services. So a client will come in. One of the things that we really love is if a family member or caregiver comes with them. Mm-hmm. It is really important for us to get the full picture, and sometimes if there are changes that are happening, sometimes you don't notice changes in yourself, and that family member or the caregiver will say, oh, well, let me complete the story.
And sometimes the view of what is going on is very different.
Yes.
Between the family or caregiver and the patient.
Absolutely.
Right. So we really love when someone comes with, but it is not a requirement. We make that clear. We have had clients that want to come on their own, and that is just as acceptable. So they will come in, and based on the time of the appointment, we have a structure where, in theory, they would start out by seeing Cindy, who does her medical exam, and she can talk more about all the geriatric syndromes that she goes over. And then they'll go through the process. They spend an hour with me. We do love also to spend time privately with the family or that caregiver. We ask permission, of course, from the client. Can we talk to your family in private? And then we can also meet together. And then there's the fall and balance assessment, which is performed by a physical therapist. That's about a 20-minute assessment. We have a pharmacist. The client can come in and bring their whole list of meds, the Kroger bag with all the vials, and she will...
I've seen that Kroger bag before.
Yes.
Sometimes it's an Ann Taylor bag, depending.
Yeah.
And as well as the supplements, the glucosamine, any supplements that clients are taking, and they bring that in, and the pharmacist will go over that piece by piece and make sure they understand what they're taking, why they're taking it, and again, this is not superseding what the physician does, it's an enhancement to that.
And I really like that it's a coordinated effort, because so many of these things interplay with one another and are factors as part of a bigger picture. Mm-hmm. To have all the pieces together.
Mm-hmm. Yeah, the team works well together. Usually after each appointment, the social worker and the nurse practitioner collaborate to find out what information the other might know that would be helpful, and the nurse practitioner and the pharmacist as well, because there's a lot of overlap in those disciplines and what we do.
So if somebody were going to make an appointment, is there any special preparation they should have for the visit?
We send a pre-visit questionnaire to them to try and facilitate getting information, get that accurate med list, and let them know that we'd like them to bring all their meds in, including their supplements, because a lot of people don't view the vitamins and the supplements as medications. Mm-hmm. they think only in terms of prescriptions. That's really the only preparation to it. Otherwise, we prep them to be prepared for the depth of the appointment and the amount of time that they're going to be there, and remind them that we'd like to bring a family member. So it's as simple as calling our office.
So when somebody comes in to seek your services and to be assessed, what is really the goal or the outcome of this initial visit?
Primarily, our goal is their goal. So if somebody's goal is to remain in their home, our goal is to help them find the resources to do so. If they're not going to be safe and the family might have a different goal, or we know that the physician feels that it might be time to look at an assisted living or a senior living community, we at least start that conversation. But the goals are to maximize independence and function so that people can be where they want to be and be as happy as they want to be.
Just a question that occurred to me, maybe you might have said it. And if you feel there's a need, you contact the patient's primary care physician and discuss things with them?
We can. They send us information prior to the visit a lot of times if it's a referral and we have an idea what's happening before our patients come in. Sometimes the family member shares that information, but not always. We don't always know what the primary care physician has in mind, or they might not be referred by that physician.
A lot of times, in particular from the social work perspective, what we're trying to do is identify unmet needs. Sometimes what happens, and I'm sure it's such a common term anymore, but the social isolation that begins to happen as people age, perhaps they're no longer driving, or they're not driving as frequently, they're not getting out of the house, and things can happen gradually. And sometimes decline begins to happen. And so what we try to do is get a full picture to then assess and say, okay, here's some areas where you're comfortable and you feel great. And again, depending on what the client is telling us and what, like Cindy said, what their goals are. A lot of time we are connecting people with resources that are right in their neighborhood that they don't even know exist. What I really love about what we do is it's so personalized and individualized. There are other places you can call and get referrals on the phone, but when you come in and we are able to really do that full picture, to look at the medical issues, the healthcare issues that Cindy is so fabulous when she's with those clients. She relates so well to them. She really makes them feel at ease. It's fascinating how she's able to do it. And to normalize what's going on and talk openly about topics that might be difficult. These are not easy topics.
A lot of times, it's the elephant in the room. A family member doesn't necessarily want to talk about it with another family member, or the patient may not want to say something. If we don't say it, it's not happening.
We see the client individually because we need to hear what's on their mind. And then when we see the family individually, to hear their perspective. And we try to weave that together. Again, our goal is to help them achieve their own personal goals. And if that is staying in their own place, fabulous. Let's talk about what enhancements you might need or what's out there, giving them resources. A lot of times in the clinical picture, Cindy has suggestions for them or can, again, touch on those tender topics.
Like you said, a lot of times it's the elephant in the room. So if somebody has been recently diagnosed with dementia, they're in the denial phase. They don't want to hear it. They think it's the worst thing ever. A lot of times it's just education to help them realize, okay, maybe you have this diagnosis, but we can help you live a meaningful life with this and remain in your home. There's a perception that as soon as you have that, you're going to be in a nursing home and that's the end of it. You're not going to recognize anybody.
I think, and I don't know what your perspective, I think that's probably one of their greatest fears. I think they really do want to stay at home if they can. And I think a lot of times they may not want to address something in maybe the best way because of that fear.
Yeah. And a lot of our dementia patients actually come in fearful that they're there to be locked up. And when I find out, why did you come in? Why did your doctor want you to see us? And they'll say, you know, I have dementia. And I'll say, okay, you look like you're a little bit fearful or you don't want to be here. Do you know what we do and why they asked you to see us? And some of them have said, well, you're here to lock me up. And we'll say, no, you know, that's not the case. We're here to find out what you want and what your family wants and what you're able to do. And we want to help you accomplish those goals. And the minute you tell them that, they're at ease. And you can start to have a meaningful conversation with them about what's out there to help them, what's troubling them, what we can do to help them get past that and adapt to some of those barriers that they have.
Your Grosse Pointe Center is relatively newer, and you started out at the Novi Center. What have you seen as the need for this type of service?
I want to say it's profound, the need. I think the biggest piece that we do is helping to educate the patients and the families together. It is maybe because we work in the healthcare industry, these things seem, you know, common and normal. They're, you know, things we deal with every day. But the need is great. The need for people to be more informed and to have more conversations, and to again be connected with what already exists in your community. But maybe you just don't know how to look it up, or you just don't know which number to call or which resource to use. People, like you said, are living longer and more vibrantly than ever, and people do want to stay in their own homes. One of the things I hear all the time of area of concern is the fear of the loss of independence. It's huge. And I really have been talking with Cindy and our other nurse practitioner about how can we reframe that idea, that it's not necessarily a loss of independence, it is a shift and we have to adapt, but not to think of it as a loss, but adapting to your new status. And just maybe begin to embrace it from a different perspective so it doesn't feel like such a loss.
Sometimes it's not always what we're facing, but how we look at it.
Yes.
Oh, wonderfully put.
Yeah.
Yes, absolutely.
And one of the other factors, I think, is when the people come in, especially with our dementia diagnoses, the families typically are overwhelmed and they don't even know where to start. Generally, they have jobs, they have their own children, they have their own households they're managing, and now they're trying to manage their parents as well. So they don't even know where to start. They don't know which end is up.
Many probably say, I don't know that I can handle one more thing on my plate.
Yes.
Oh, yeah.
Yeah. And so our job is to help people cope and have a plan in place before there's a crisis. We want to stay ahead of that crisis because you don't make good decisions when you're emotional, when there's turmoil, when somebody's hospitalized. And I had an example of that myself. My father-in-law has dementia, and there was a crisis at the assisted living last weekend, and I had to go spend the night, and I was that person that was overwhelmed Sunday morning, and I went home, and I literally was in tears, and I talked to a friend that works with senior services, and you know, it was a simple reminder, okay, if this happens, then we're going to do this. You call this person, and I said, oh, you're right. You know, all these things that we tell our families, despite all of my experience when I was in the midst of it, I forgot all of that. And I was that person that was overwhelmed and didn't even know which way to start, and the world was caving in, and I have to go to work on Monday. What am I going to do? So we can help people with that.
When you're in the middle of the picture frame and when you're looking at the picture.
Yes.
For sure.
Yes, and when you've walked in those shoes, you can offer, you know, I've been where you are, and this is what you can do. We do a lot of education for the families just to help them cope with things, to tell them it's okay sometimes to be angry. It doesn't make you a bad person. Everybody runs out of patience. The big thing is to take a break so that you can regroup and refresh and go back.
When people, excuse me, are seeking your services, do they still keep their own primary care physician?
Absolutely.
Yep. Like Carmela said, we're an enhancement to the physician services. So we make recommendations that go to both the patient and family as well as the physicians.
One of the things that you offer is like a driving assessment, and you have a driving simulator, is that right? Mm-hmm. Tell me about that.
Yep, it's a computerized simulator, and we do 5 trials and scenarios, and we test a number of domains that might be problematic when driving. So we look at reaction time, the ability to process information in the periphery and react to it by touching a button on the simulator. The end scenarios have pedestrians that walk in front of people, cars that pull out in front of you, construction zones, and they have to process that information and be able to perform. And at the end of these 5 trials, we actually get a printout with objective data that we're able to summarize and give to the physicians. So a lot of times it's just as simple as somebody knows they shouldn't be driving and they needed to come in and see that in a safe environment where the physician can say, you know, you hit 2 people or you hit 3 cars or you cross the center line 28
Fortunately,
times.
it was only on the screen.
It's
Yeah.
it's a safe environment.
And to be fair, some people we think are not going to do well do better than we think they will.
Yeah.
And then we're comfortable saying, take an on-road test
Right.
and see how you do.
We did have that one gentleman back at the end of summer. He had suffered a stroke in the spring, and his physician had said, you know, we think you're getting ready. He wanted to go back to work. He was highly motivated, and he took the driving simulator, and he was so happy because he did fabulous, and it was just
Probably gave
that
him confidence.
it was the way for him to again begin to bridge into, am I going to be able to drive again? And it was really encouraging. So we get to see both sides of that. Likewise, we had the other gentleman who missed every distraction on the left.
Yeah.
So
you know, that's a danger because somebody that's not processing information on their left side might not see that child run out from between cars.
And a lot of times a patient just does not have an awareness of this.
right. I do want to add the driving simulator, just so people understand about our services. The driving simulator is a private pay service. It is not covered by insurance. We have priced it affordably at $100 for the assessment. Our assessment
And maybe you could, if you, not to interrupt you, but you can go over, does insurance cover anything, and if not, what are some of the costs involved?
Right. Well, I wanted to highlight that because the driving simulator is private pay. It is $100, but our service is covered under Medicare per your guidelines. There's so many different insurances. So if you have a copay, people are responsible to know what their copays are under their Medicare Advantage plans. But it is a Medicare covered service to have the full assessment. The driving simulator being separate, that's private pay. So whatever your office copays are would be the normal cost.
And then you also, I think you touched upon that before, you test somebody's balance. And that's very important too, because a lot of times, our balance isn't as good as when we were 20.
Yeah, and strength plays a factor.
And so maybe you could take me through some of that as well.
That's the physical therapist typically checks that. They have people do a functional reach test, which is bending forward at the waist to see how far they can reach and remain balanced. They also have them stand on a foam pad with their eyes closed. So they put them through some trials to see if they start losing their balance when they're not able to see the information in their environment. They test their gait and just their overall ability to be steady on their feet. A lot of people after falls become very fearful, and it's almost a learned helplessness per se, where they're afraid they're going to fall again, and it keeps them from doing things and recovering fully.
And I think probably following up on what you said, a lot of people who are the senior patient probably goes in fearful of, how am I going to be restricted, what's going to be taken away? But I think a lot of what you're saying is a lot of it is just educational discovery and helping as opposed to taking away.
Yeah,
Absolutely.
And as we all know in healthcare, it can be far better to be preventative and proactive and to kind of be ahead of the curve with things as opposed to try to catch up once more of a crisis has happened, if that's possible.
Well, and it is a common theme that we talk about. Don't wait for the crisis, and have a plan in place. So again, a lot of it depends on what the client and the family bring when they walk in the door, what issues they raise, what their concerns are, what they want to focus on. And so the scope of the topics that we cover is actually quite broad because there's so, as varied as there are people out there. But the common themes are wanting to remain as independent as possible and have a very high quality of life. And those are the foundational goals.
Yeah.
Does somebody have a follow-up appointment, or is it a one-time appointment?
Generally, it's a one-time, but we do have follow-ups occasionally. Typically, we might have a follow-up with Carmela or Marianne, our other social worker. If people need additional resources, they can do follow-up short-term counseling. We can do a follow-up cognitive screening. If somebody's borderline, we might have them come back in 3 months and compare.
And for somebody who may not necessarily be aware of where the Ralph Wilson Center is located, it's conveniently located.
We're at the corner of St. Clair and Kirchable. So we're right off of St. Clair. You would park in parking lot 3. We're right next to Edward Jones.
So it's really very convenient.
Very convenient.
Yeah, it's very easy in and out, and it was designed that way so that the seniors were able to navigate in and out of our door if they had assistive
And what
devices.
hours do you offer your services?
We're Monday through Friday, 8 to 4:30.
That's great. That's great.
Same
That's
hours
great.
in Novi.
Great, great. Well, you've both been very helpful, and I've been interested in hearing what you have to say, as I'm sure our viewers have as well. And thank you, Carmela.
Well, thank you so much for
Appreciate
having
your
us
time.
today.
Thank you.
Thank you
Yeah,
as
it's
well.
been a pleasure.
Thanks for having
Appreciate
us.
that, Cindy. And any questions? You can give them a call. And thank you as well for tuning into our show. As always, I appreciate the time you spend with us. Take good care of yourself and those around you, and have a great day.